There comes a time when we are inspired by different occurrences in our life, and today on our segment, My Story, we're bringing you a wonderful lady who is already on set. As you can see her, she's going to tell us who she is, what she does, and where she is even. Right about way, now we jump into it, and this is her story. Hello.
Hello.
How are you?
Fine, thank you.
What's your name?
My name is Grace Njiro.
Grace Njiro?
Yes.
Where were you born? Give us that background thing.
I was born in Kirinyaga County, then Kirinyaga District. I grew up there.
Yeah.
I went through primary school in Kirinyaga.
Yeah.
And for my high school, I came to Nairobi, the Precious Blood School at Riruta. And I later joined Kenya Medical Training College in Nyeri for my nursing.
Wow. Yes. So you and Mheshimiwa Martha Karua, you are neighbors?
Yes.
Wow.
We come from the same neighborhood.
I think I should go there. It seems the land of learned women.
Yes.
Okay. Now you graduated in what profession when you went to medical school?
I did a diploma in nursing, the Kenya Registered Community Health Nurse. I did that for 3.5 years, and thereafter I joined, of course, the nursing field. I went to Nazareth Hospital. I worked there for 7 years. The first 3 years, I worked as maternity in charge in the hospital, and I was given an offer to assist in their college to teach nursing process and practice. But when I started assisting in the teaching, I liked it, and I requested if I could continue teaching. And there I started my tutoring profession. And I liked it. I liked mentoring young nurses who are aspiring to join us. Yes.
Nice one. So there you are, mwalimu ndio huyo. So where did you go after that?
When I was in Nazareth, I really worked in the midwifery department or the maternal child health department. And even when I went to teaching, my inclination for midwifery persisted on. Until an offer came for me to go and set up a maternity program in South Sudan. And that's when I left the country. I went to South Sudan with a faith-based organization serving in mission and worked for them for 2 years. And again, because one person who likes challenges, I felt like I needed more on my plate. And I moved on to an international NGO, again, managing maternal child health programs. And there I stayed again for 6 years, working in the refugee camps, setting up programs for the refugees and even the host community.
How can you rate health provision to the society? How can you say, how is it?
In Kenya or in South Sudan?
Both ways.
Well, of course, in Kenya, we've gone milestones ahead because we have health care for the common wananchi and even for the affluent. I was lucky to work for both. For those who are, we'd call middle and lower class. And I also would go for pool, what we would call locum in Aga Khan. So I also got to have a taste of the modern medicine or healthcare. So in Kenya, I would say that we have facilities. Of course, we are now trying to move to technology in healthcare, artificial intelligence in healthcare. But we can say that we are miles ahead. Well, on the other hand, in South Sudan, you find that because of having been in war for a very long time, the country's healthcare system needed a lot of support. And that is why NGOs, the UN, would go to support the system for them to be on their feet. That's
nice. So basing on that, Chesed Home, where did this come from? Just tell us from where were you even inspired to come back, Chesed Home, and here we are.
When I left South Sudan, I felt I needed a break. Having worked in a harsh condition and environment for 6 years, I felt I needed a break before jumping onto the next venture. And it is during this break I decided to seek God and ask what is it that I can do for my country, for my people. And while looking at that, something inspired me, and this is an experience from my own family. And I thought about it. Why not start home-based care, or what you call home health care services to serve the people? And that is how Chesed was born. Okay, I have mentioned that family experience is what led me to start Chesed Home Health Care. Being a nurse and being outside the country, I would get information that grandma is unwell, she was admitted, or any other family member. And sometimes it would really, affect me, because I felt maybe if I was at home, I would help the family members to navigate healthcare. However, it was a period where I was not able to do much. But now when I came, when I would come for my breaks, because I would go work for 3 months and then probably come for 2 to 3 weeks. During my breaks, I'd ensure that I visited my grandparents, who I was very close with, and they loved me a lot. So I always took time to go visit them. And one time I found my grandmother had been bedridden for 3 months. And that surprised me, because I did not know that she was bedridden. Now I started finding out how they are taking care of her now that she was bedridden, because as a health worker, I already know the risks. There's what we call bed sores, because of long periods of being in one position or lying in bed. And I could ask, do they turn her? For how long is she in a certain position? Then there's also what we call static pneumonia, when someone has been lying or immobile for long. So those were concerns for me. And when I realized that the caregiver, who was now a domestic care worker, who transitioned to the role of a caregiver, did not have the right skills. So I went ahead to probe how they were going about the care, the feeding, and I realized there was need to get a skilled caregiver. The period was very brief, because I was supposed to travel in 2 days. But having a discussion with my grandfather, he said it is okay, we can bring in a caregiver. So I passed on the information to my aunties who were concerned, and they started looking for a caregiver. Meanwhile, I left to South Sudan, and a week later, I was called that my grandmother had been admitted because she was not feeding. And I thought maybe if someone had paid attention to the nutrition aspect and care for the elderly, probably she would not need to be admitted because of feeding. And at the hospital, they tried to put some tubes for feeding. We have different feeding modes for people who are not able to feed on their own, like the nasogastric tube. We have another tube which is put at the abdomen or the stomach. It's called the PEG. Percutaneous gastric feeding. So now she had to go through surgery to insert this tube for her to be fed. And during the hospital stay, one thing led to another. She complicated, and finally she rested. By the end of about 2 to 3 weeks, the family had incurred quite a big hospital bill, above 5 million, which I thought, from a feeding...
5 million?
Yes.
In 2 weeks?
Over 5 million.
Over 5 million?
Yes. So
okay.
From a feeding issue to grandma resting, and the family has to deal with a very high hospital bill. Nobody wants to let go of their loved one.
Very true.
And what I usually tell families, even if someone is to rest eventually, maybe because of a terminal illness or chronic condition, we say let the person rest in a dignified way, respectful and dignified way. And if families can also be able to save money, then why not, bring a service that can help families navigate healthcare at affordable costs.
Okay.
So now that experience, of course, left me with a bitter taste in my mouth because I kept feeling, what if I was around? Maybe I would have gotten a caregiver, and the caregiver would have helped with, feeding, and grandma didn't have to go through this surgery and eventually rest because she went to the hospital because of a feeding issue.
Wow. And you can imagine maybe how many other grandmas are out there, grandpas who have already rested because of similar issue.
Yes. And that was my paternal grandmother. And then the same year, that was my paternal grandmother rested in June, if I'm not wrong.
June which year?
2017. Now, November 2017, another grandmother rested under a condition that is not very clear. And when I tried to, look at the circumstance, I felt maybe if there was a caregiver with her, the issue would have been addressed and probably would also not have lost her in that circumstance. But my grandmother didn't have anyone with her because she was found dead.
Okay.
So we feel that if there was a caregiver, maybe even if she was unwell, then the caregiver would have raised alarm and said, she's not well, and maybe would have rushed her to hospital. But at least feel that there was something that was being done. But now it was just reported she was found dead. We thought we'd have her around for many more years because she was not sick. She didn't have these chronic illnesses like diabetes and hypertension. She was in good health.
Now we are seeing exactly where all this was born, and why Chesed Home was now given a reason to be there.
Yes.
So tell us about Chesed. What do Chesed do? Who are they? What are they trying to solve, and all that?
Okay. Chesed Home Health Care.
What does Chesed mean first?
Chesed is a Hebrew word for God's grace.
Oh, and your grace, Njiru.
Yes.
What does Njiru mean?
Njiru means black in Kikuyu.
Oh, so you are a dark grace Kikuyu lady.
Yes.
Okay.
Although Njiru is my dad's name.
Okay.
So it's my surname.
Okay.
So,
Chesed. Meaning of Chesed, and Chesed is here.
Well, it's not my name that really inspired me to.
It's a coincidence.
Chesed,
more of.
But I wanted to have a name that would speak to the people.
Yes.
I wanted compassion. So the name Chesed, being a Hebrew word for compassion or God's love, was very appropriate when I was thinking of a name.
Yeah.
And so. Chesed Home Health Care is an agency whereby we look at the health needs of people who are having illnesses that go beyond the hospital. When one is admitted with a condition, we call that acute care, and that is what most hospitals address. However, for those with chronic illnesses, terminal illnesses, they need that care to continue at home.
So chronic illnesses, for the sake of our viewer understanding, it means these are long time conditions.
Yes.
Yeah, maybe you can mention some of them.
Okay, a chronic condition simply means that this is a condition that is not going to be cured. So the person will live with it for the rest of their life.
Okay.
But now,
terminal
again is a term used for an illness that says this person will eventually rest. And there are many terms. If I go into the definition, because we also have palliative care, hospice care, and they're all relating to these terminal illnesses.
It's okay.
So basically, we are saying that chronic conditions are those like diabetes, hypertension. So it's just about
tuberculosis them. That is curative,
That can be cured.
Okay.
Yeah. We have also obstructive pulmonary disease. We have cancers. So there are many conditions which can be grouped as chronic.
Chronic,
And it doesn't mean that the person is dying.
Yes.
for example, if one is diagnosed with diabetes, it doesn't mean they are dying tomorrow.
Yes.
We are saying we are going to adjust their lifestyle for them to live with
meet
this
the
condition.
conditions that are required.
Yes.
Nice.
So those are some of the conditions we address, just to help the person adjust or adopt a lifestyle that is going to help them live quality life with this condition that has been diagnosed.
Okay. Now, your kind of service and the care, community-based healthcare service, like caregivers that comes from the hospital, how do you distinguish the two? Like, are you doing the same thing, or yours is more of a customized?
Okay. When you go to definitions, for example, the Nursing Council will call what I'm doing community nursing services.
Okay.
We also have another group of people we call community health workers.
Yes.
So the names may be used interchangeably.
Yeah.
But at the end of the day, this is home-based care. People tend to associate home-based care with maybe things like HIV, because I remember when HIV was rampant.
Yeah.
Then even the government came up with a home-based policy for HIV patients. But now we realize we are dealing with more diseases that need that continuity of care.
Okay.
So people may call it home-based, others may call it home health care, others may call it community nursing services, but all those mean more or less the same thing. But now what may define or differentiate is the scope.
Okay.
For example, I being a nurse, I have a different scope as far as home-based care is concerned as compared to a community health worker.
Okay.
Yes.
So now, since we've distinguished the two very well, now, so what are your services you as Chesed Home?
We have quite a number of services. For example, we have what we call activities of daily living. Activities of daily living are those things that you and I are able to do when we are well. I'm sure you don't think twice about brushing your teeth.
Very true.
You don't
Automatic.
think twice about going to the shower.
Very true.
But what happens after someone has, say, sustained an accident, they have a cast on their leg and they are not able to get out of bed without assistance. They'll need someone to assist them with bathing, someone to assist them with maybe even brushing their teeth, feeding, and taking their medication. Those are activities of daily living. Then there are other services such as wound care. This is just what we call wound dressing. In most people call it wound dressing, but we call it wound care management. We do that. We also provide nutritional support. When I say nutritional support, there are people who are not able to eat because of, say, long-term illness. The elderly also have a lot of malnutrition and nutrition-related issues. So depending on what is at hand, we offer nutritional support, and we work with nutritionists and dietitians to navigate this area. We also provide physiotherapy, occupational therapy. Occupational therapy is where someone who's probably had an accident or a child born with disability is learning to do certain activities. For example, people with arthritis may have deformity on their hands and they're not even able to lift, say, a cup.
Okay.
Now, how does this person regain that function? For a child who has a disability, how do they develop that function for them to be a little bit independent and not totally depend on somebody? So we have that kind of service. And on top of that, we offer counseling. Patients who are going through terminal or chronic conditions have a lot of, acceptance, denial. So you're just helping them accept what they are going through. And even for the families, do they understand what their loved one is going through? How best can we support them? Sometimes they give their best and then they're not seeing the outcome and they tend to lose hope. So we also do family counseling for our clients, among other things. So it basically depends on what we have been called upon to do. We assess the client, come up with the needs, specific needs of that particular client, and then draw an individualized plan. When I say individualized or custom made, it simply means it is for this particular client. And then we match them with a caregiver who is now going to be able to assist them.
Okay.
Yes.
Where are your services found?
Well, our office is found at Aliza Plaza, second floor, room 23. However, our services are not restricted by location. We have clients as far as Embu, Kandara, Gatanga, Kikuyu. So we go to where the patient is.
Wow. So in short, you are everywhere. It's just a phone call away.
We are just a phone call away.
Are you guys on social media?
Yes, we're on social media. We have a Facebook page, Chesed Home Healthcare. We're on Instagram and Twitter. Yes. And we also have a website where you can also go, learn more about us at www.chesedhomehealthcare.com.
Do you have like a service number where they can call you people?
Yes, we do.
Maybe you can just look at the camera and tell us.
Okay. You can call us on 0745 860 188 or 0722 63 4076.
All right. Okay. Now, what is the parting shot that you'd love to give both to the families watching you right now and other medics who are watching right now? Just a word of hope so that we can continue doing this.
Okay, to the families, I know most people are even afraid of calling us because they feel maybe the cost will be too much. But what I tell families is just open up, discuss with us, and we come up with a way of helping the client, because in African setting, I know we don't even talk about death. So when you have a loved one and they're going through, maybe the end of life, people don't know what to do. But just working with the family makes it a lot easier for the family, and even for the person, the person who's unwell or going through a phase of sickness. So I encourage families to speak out. And for healthcare workers, I feel this is a niche which has not been fully exploited. And because I cannot be everywhere, I would embrace other healthcare workers taking up this and providing quality services to the community members.
Wow. That is Grace herself telling you exactly where she's come from, where she is right now, and where she wishes every medic to be. Mine is to tell you, my story tells you today that it comes out of the heart. She is Grace, bringing you Chesed home just to care for your patients, and that's how we log out. On your right, there is a subscription note. Right there, subscribe. And just beside it, there's a bell called notification bell. That bell is for you. Whenever Grace brings you the good news about health, you'll be the first one to see it. And don't forget, you might be serving and saving a life somewhere. Share this video to your neighbors, to your friends, even to the international community. And let's say it just like Chesed home. Stay blessed. Till next time. Bye.